Добрый день.
Good morning, dear colleagues and guests. Today, the 30th of June, 2021, 11 o'clock Moscow time. Let me start the session of the academic committee. Candidate will be open, dedicated to the defense of a dissertation written by Oksana Aleksandrovna Volkova, seeking an academic degree, candidate of medical sciences in the degree field 140203, public health and healthcare, on the topic scientific rationale of the reassessment methodology of state medical organizations, resources, utilization, efficiency. According to the Act of Academic Secretary, St. Petersburg University, dated on the 8th of April 2021, I, Igor Mikhailovich Akulin, Doctor of Medical Sciences, Head of the Department of Healthcare Management and Medical Law, St. Petersburg University, was appointed chairman of this dissertation committee. The same act stipulates the other membership of the dissertation committee. That includes Olga Vasilyevna Mironenko, Doctor of Medical Sciences, Professor of the Department of Healthcare Management and Medical Law, St. Petersburg University, Marina Alexandrovna Shapovalov, Doctor of Medical Sciences, Head of the Department of Economics and Healthcare Management of Astrakhan State Medical University, Dmitry Olegovich Meshkov, Doctor of Medical Sciences, Chief Fellow of the Institute of Research Fellow of the Institute of Problems of Management, named after Trapeznikov, the Russian Academy of Sciences, Alexander Leonidovich Lidenbratton, Doctor of Medical Sciences, Professor, Head of the Research Division of National Research Institute of Public Health, named after Shimashko, Pavel Nikolaevich Zolotov, Doctor of Medical Sciences, Deputy Minister of Healthcare of Samar region, Andrei Gennadievich Lukin, Doctor of Medical Sciences, Professor of the Department of Applied Management, Samara State Economic University, Andrei Mycheslavovich Grzybowski, PhD, Professor of the Department of Politics and the Organization of Healthcare in Kazakh National University, named after Alpha-Arabi, Kazakhstan. Also with us is Oksana Aleksandrovna Volkova, the candidate, and also the academic supervisor of the dissertation, Sergei Nikolaevich Cherkasov, Doctor of Medical Sciences, Chief Research Fellow of the Laboratory of Public Health Management, number 81 of the Institute of Management Issues, named after Trapeznikov, Russian Academy of Sciences. I would like to inform you that audiovisual recording is carried out on the website of the St. Petersburg University, accompanied by a simultaneous interpretation between Russian and English. Also, there's an email on the website where you can send questions, but they should be signed, and affiliation should be supplied of the person who asked the question. And all the questions that have to do with the medical discussion, with the academic discussion and the dissertation, the text of the dissertation and the presentation will be read in accordance with the procedure of awarding academic degrees at St. Petersburg University. A session of the dissertation committee is legitimate if not less than 2/3 of the of the established membership of the Dissertation Committee is present, but not fewer than 4 people. Our Dissertation Committee consists of 8 people. All 8 people are present, therefore the quorum is there. The procedure is proposed the following. First, short presentation by the chairman of the paperwork that has been submitted by the candidate. Answers of 2 possible questions, not more than 5 minutes. Short presentation of the candidate, not more than 15 minutes, strictly on the dissertation. Then questions to the defendant, strictly on the presentation, not more than 2 minutes per question. Answers of the candidate, 5 minutes for all questions. Presentations of all members of the Dissertation Committee with their reviews, questions and comments, not more than 10 minutes per speaker. Then the presentation by the chairman of his review, not more than 10 minutes, then followed by answers of the defendant to all questions and critical remarks on not more than 20 minutes for all questions, and then open floor discussion, not more than 2 minutes per speaker, and all the people, all the members of the audience who would like to speak up, need to register in the logbook in order to do so. Then after that, all the questions that have been submitted to the email address of St. Petersburg University that relate to the dissertation or the presentation will be read. Longer questions that would take 2 minutes to read will not be read. Answers of the candidate, not more than 2 minutes per question. Then the academic advisor will be given the floor, not more than 3 minutes, to talk about the candidate and the work that they've done on the dissertation. Then the discussion of the Dissertation Committee members before an open roll call voting, and then open roll call voting in order to reach a decision on the resolution or to award or not to award the sought academic degree, and then the decision will be announced, and then a concluding statement from the candidate, more than 2 minutes. I would like everybody to switch off the sound on their mobile phones, except those who are online with us. We don't have any like this, and so everybody should switch off their phones. I would like to start the procedure with the first item, the short presentation of the chairman about the paperwork that has been submitted by Oksana, Aleksandrovna, Volkova. The paperwork has been submitted in full compliance with the regulations, and therefore the dissertation was accepted for defense by act of the academic secretary of St. Petersburg University on the 3rd of March 2021. Volkova Oksana Aleksandrovna wrote her dissertation in the National Research Institute of Public Health, named after Semashko, supervised by Sergei Nikolaevich Cherkasov. The number of publications is 13, out of which in refereed journals approved by the Ministry of Science of the Russian Federation, 6 publications. All the other documents that have been submitted are in full compliance with the procedure of awarding degrees at St. Petersburg University. Copies of the paperwork is available from the member of the management of Dissertation Council's office present here. Dear members of the Dissertation Council, dear members of the audience, do you have any suggestions or questions as to the general procedure? No. Therefore, I would like to give the floor to the candidate for a short presentation. Dear Igor Mikhailovich, dear members of the Dissertation Committee, I would like to present my dissertation in public health and healthcare, scientific rationale, the assessment methodology of state medical organization, resource utilization and efficiency in the context of limited funding for healthcare and a continuous growing demand for medical services. The provision of quality medical services is impossible without the efficient use of resources, including at the level of a separate state medical organization. At the same time, at present, the irrational use of resources is manifested both in the distribution between the sectors of the healthcare system and at the level of public medical organizations, leading to economic losses, a decrease in the efficiency of investment in public health, low competitiveness of public medical organizations, an increase in paid services and high level of public dissatisfaction with the quality and availability of free medical care. The severity of the problem, which has increased against the background of the ongoing reforms and the need for scientific search for management tools that can ensure the high efficiency of the functioning of medical organizations, determine the relevance and the scientific topic is practical significance. The purpose of the study is to develop the scientifically substantiate a methodology for assessing the efficiency of using resources of public medical organizations. To achieve this goal, the following tasks were solved: to study the current state of the problem of the efficiency of using resources of medical organizations. Second, analyze the results of the implementation of the methodology, the quality standard of resource management of public institutions in the city of Moscow, based on its implementation in the field of healthcare. 3. To develop methodology for assessing the efficiency of the use of resources of public medical organizations, taking into account the industry specificity of healthcare, and to test it. The object of the research is the results of resource management of public medical organizations. The subject of research is a methodology for assessing the process and results of resource management of public medical organizations, a system of indicators of quality resource management, etc. The base of the study is medical organizations of the state health system of the city of Moscow of all types and nomenclature by types and conditions of medical care. 28 medical organizations took part in the pilot project in approbation of the methodology for assessing the effectiveness of the use of resources of the state medical organizations. 220 medical organizations of the state healthcare system of the city of Moscow. Taking into account the nomenclature of medical and medical differences, we form four large groups: hospitals, polyclinics, children's dental clinics, and adult dental clinics, which are autonomous organizations. The first provision for defense. The existing systems for assessing the effectiveness of the use of resources do not take into account the specifics of the activities of a medical organization, do not allow adequately assessing the efficiency of using the resources at its disposal. In order to effectively use budgetary funds or government funds and improve the level of management, the Moscow government decided to conduct a pilot project to implement the standard for the quality resource management. State institutions in 4 areas of the city, economy, healthcare, education, culture, and social security, were considered as the subjects of the standards management. During the implementation of the project, institutions were asked to determine their level of quality in resource management, identify problems, develop and approve individual qualities improvement programs. However, significant differences in the areas of activity of state institutions of the social sphere and the corresponding specificity of regulatory regulations, legal regulation were not taken into account by the standard. The second provision for defense, the use of the standards by the state medical organizations is inappropriate due to the presence of significant differences in the areas of activities. Based on the results of the analysis of the implementation of the standard in medical organizations, it was revealed that the methodology doesn't take into account, first, significant differences in the areas of activities, features of the legislative regulations of the activities, differences between state medical organizations by types and conditions of medical care, financial support of medical organizations at the expense of compulsory medical insurance funds, targeted subsidies for the provision of medical care to certain categories of citizens, high-tech types of medical care, heterogeneity of the main personnel of medical organizations, particularities of legal regulations in healthcare and the existing reporting of medical organizations. Thus, due to the presence of significant differences in the activities of state organizations in the social provision, social services provision types, the use of standard as a tool for assessing state organization is inappropriate. The third provision for defense, the proposed methodology for multifactorial assessment of the management activities of public medical organizations makes it possible to identify reserves and plan directions for optimizing internal processes. Based on the results of the analysis of the implementation of the standard in the field of healthcare, the study of regulatory legal documents, literature resources, questionnaires, and interviews of heads of various management structures of medical organizations, consultations with the expert group of the Department of Health, we have developed a methodology for assessing the efficiency of using the resources of medical organizations and determined a unified procedure for its implementation. The methodology initially took into account the heterogeneity of medical organizations due to typical differences in types of conditions of medical care, specific of financial support, regulatory regulations, etc. The efficiency assessment proposed by the methodology is based on the analysis of values of 30 indicators characterizing 14 efficiency factors in 6 areas of resource management, finance, procurement, property, personnel, information and extra budgetary activities. A comprehensive assessment of the effectiveness of medical organizations is a summary assessment of indicators in 6 areas of resource management. To calculate the values of indicators, the parameters of the activities of medical organizations reflected in various forms of approved reporting are used as the numerator and denominator. In the evaluation criterion, the target interval of the possible value of the indicator, the complexity coefficient has 3 levels and is assigned to an indicator depending on the compliance of its actual value with a certain target interval for the assessment of the assessment criterion. The weighting factor determines the significance of the indicator within one management area. The sum of the weights of one control area is 1. Evaluation of effectiveness can be carried out on the basis of actual data or in dynamics for all medical organizations, for groups of medical organizations, subgroups, indicators, coefficients of complexity, efficiency factors, and areas of management. A comprehensive assessment for specific assessment for specific on management allows you to highlight both the best medical organizations and identify problems. The unified assessment procedure proposed by the methodology provides for determination of the initial level of efficiency of resource management, development and approval of an individual efficiency improvement program that fixes the planned values of indicators, quarterly monitoring providing for an assessment of the dynamics of changes in the actual values of indicators, analysis of deviations assessment of program implementation of the degree of achievement of planned values and indicators. To assess the effectiveness of financial management of medical organizations, the methodology provides for 10 indicators characterizing 3 efficiency factors: rationality of the use of financial resources, the quality of work with debt and the quality of planning activities, the efficiency of rationality of the use of financial resources by a medical organization is assessed based on analysis of structure of expenses provided by the plan of financial economic activities for the current year. The quality of work with debt is assessed by means of indicators of accounts payable and receivable, and an indicator of the ratio of income to expenses of the organization, which characterizes the financial stability of medical organizations. Taking into account the expert opinion and peculiarities of various nomenclature groups of medical organizations, and the interval boundaries of the values of the criteria for assessment, the payroll indicator are differentiated. AUP taken into account in the calculation of indicators has been brought in line with the form ZP Health, ZP Science, a list of non-medical expenses with the order of DZM. To assess the effectiveness of procurement management, 6 indicators are used that characterize efficiency factors: the quality of planning, the procurement discipline, competitive procurement, and the quality of contract execution. Since medical organizations are not organized of joint centralized tenders in the calculation of indicators 11 and 12, we consider only independent purchases, taking into account the typical features of medical organization, the provision of the law 223 federal law FZ on procurement of certain types of legal entities. The evaluation criteria for joint bidding have been differentiated. Assessment of the area of property management is carried out by means of 4 indicators characterizing 2 factors of efficiency: the efficiency of the use of fixed assets and the quality of their content. Considering that real estate objects of Soviet construction located mainly in the group of hospitals have large adjacent territories, the consideration of which in the calculation of the indicator predetermines unequal conditions for different nomenclatured groups of medical organizations, it was decided not to take these areas into the calculation of indicators 17 and 19, accrued receipts, and the amount of maintenance costs per 1 square meter of real estate. Taking into account the differences of medical organizations by types and conditions of medical care and the related difference in the cost of maintaining property, the interval values of the criteria for assessing indicator number 10 are differentiated, increased for hospitals. To assess the effectiveness of personnel management, 6 indicators are used to characterize such efficiency factors as the system of remuneration of personnel, turnover of personnel, sufficiency and redundancy of personnel, and the level of their qualification. Personnel turnover is estimated by the ratio of the number of those who quit to the average number of employees in the reporting period, and the indicator of the share of personnel under 50. Take into account the optimization process in healthcare in order to increase the objectivity of the indicator of the ratio of the number of quitters to the average number of employees. Employees laid off due to staff reductions or are not taken into account in the calculation of the indicator. According to experts, to assess the dynamics of changes in the age composition of medical organizations, employees under the age of 50 are taken into account as young employees. Since AUP is the most expensive labor force of medical organizations, to control costs for this category, and indicators provided for the share of AUP in the total head count, which is a classic indicator for assessing the effectiveness of any enterprise or organization. Taking into account the requirements of the legislation for the information openness of the main activities and the official websites of medical organizations, the method uses 2 indicators characterizing the efficiency factor: information openness of the main activity. To assess the management area income generator activities, 1 indicator is used that characterizes the efficiency factor, raising funds from non-budgetary sources, not non-government sources. We consider own revenues of medical organizations, extra budgetary receipts. Report on Form 05-3737. MHI funds, which are extra budgetary funds, are accounted for within the total amount of funding or the denominator of the indicator. Based on the results of the approbation of the methodology in the network of state medical organizations in the city of Moscow, one can speak of positive results in its implementation. The growth of a comprehensive point assessment of the efficiency of using the resources of medical organization is noted in all periods of the implementation of the methodology. A differentiated approach to the selection of the boundary values of the criteria for assessing performance indicators, depending on the types differences between medical organizations as well as differences in the types of conditions of medical care, provided an equal influence on indicators on the value of the complex score and the compatibility of total scores with both in the areas of resource management and the context of groups of medical organization, which is clearly shown in the diagram. In relation to 2017, there was an increase in the accrued receipts per 1 square meter of real estate, an increase in the average number of doctors, and in the share of personnel medical organization under the age of 50. The salaries of medical workers have increased significantly. At the same time, problems persist, and the share of doctors with qualification categories is steadily decreasing. Let me dwell on the conclusions of practical recommendations. Let me not dwell on the conclusions, practical recommendations. They're presented in the handout. Thank you very much for listening to me. Dear members of the Dissertation Committee, do you have any questions strictly on the presentation, please? Yes, please, Olga Vasilyevna. Dear Oksana Aleksandrovna, would you tell me the proposed methodology, can it be applied to private medical organizations? It's applicable in some way to private medical organizations. If this organization, if an organization decides to use it, the financing is from income, its own income, then we could adjust some indicators on revenues, for example. And then you have to adjust the tender, the procurement indicators, because they can buy anything anywhere, and then the specifics of private medical organization is the ratio between the management and the working staff. That's drastically different. I have two questions. The first one, as far as I understand, your research is a modernization of a standard. So, as the profound of the standard and Moscow government, I don't understand. Yeah, could you take off my mask? I can take it off. My question, as far as I understand, is the adjustment of the standard of quality control by Moscow government. So, why did you decide to take that as the basis for modification, provided that it has so many drawbacks? And second question, why is financial management, the extra budgetary and non-budgetary revenue, this interest? We are a state research institution, and that therefore the pilot project was initiated by the government of Moscow, and we were tasked to supply methodology for it, and assess the quality of the pilot. We met with medical organizations and the Department of Healthcare of Moscow, and so we decided that the standard was not applicable, and we were tasked that we needed to provide an analogous methodology. And the second question, we are not approaching our research areas not from an economic point of view, but from a management point of view. And because with state organization, again, we focused more on government funding, and we didn't subdivide the extra government revenues of an organization into different categories. Dear colleagues, any other questions? Could you please tell me what is the effectiveness? When we talked about the efficiency, you said that the overhead costs, the management costs have not decreased drastically. Why? Well, across all the organizations, including large hospitals and small clinics, like dental clinics, for example, the main problem in the increase of overhead costs, for example, the structurally, even small organizations have to have a chief accountant, CEO, and other positions that are specified by the law, and therefore the number of staff that are actually performing procedures are quite small, is quite small compared to the number of management staff. In 2015-2016, well, there was a downsizing and amalgamating small children's dental clinics, state-funded, and so therefore the ratio is increasing because there's only one chief accountant for a large organization now. Are you the chief developer of the project? Since 2014, I've been participating in the analytics work. According to me, I'm more involved in personnel management issues. I understood more procurement issues rather than financial flows and HR management. So, dear colleagues, we are now turning to the reviews by the members of the Dissertation Committee, and then the according to the regulation. I would like to ask you to shorten your review because it was published, 2 critical remarks and main key issues. Orl Vasilyevna Mironenko, please, could you speak, please? Let's read your review. Dear members of the Dissertation Committee, to your chairman, looking through the dissertation, examining the dissertation, I would like to stress the relevance of this thesis. The relevance because the tasks were very relevant. All the tasks were fulfilled, and I would like to stress the academic originality and the practical significance, very high level of the number of publications in journals approved by the Higher Station Committee and other state organizations. The structure of the thesis is traditional. I had no critical remarks on the substantial parts of the work, but some questions. Out of all the methodologies, do you see as key maybe the financial component or personnel assessment? I will ask you my questions one by one, if you can. As far as there are all elements you have to take into account, but with all the due respect to all the other components, personnel is the main thing. And the evaluation of the effectiveness of resource management organizations characterized by the functioning and performance of the human resources, the effectiveness, the quality of use of which largely depends on the results of all aspects of the organization's activities and its competitiveness. And I would like to give you a detailed characteristic of the pilot project and what the criteria were for choosing a specific organization. In order to efficiently use budgetary funds and improve the quality of management of state and municipal priorities in the social sphere, in 2014, the Moscow government initiated a pilot project to introduce the standards for the quality of resource management of public institutions in the city of Moscow, dated February 18, 2014. And the criteria for the selection of medical organizations participating in the project was to ensure a representation in the project of the entire existing non-nomenclature of medical organizations, depending on the types and conditions of medical care, as well as the types of medical organizations that existed at the time of the pilot project. So there were 3 types of organizations: private, autonomous, and government state organizations. And the third question: what was the economic efficiency of the implementation of this methodology? And please remunerate the indicators on which this assessment was based. Evaluation of effectiveness. First of all, the own funds increased, and and there was a small decrease in overhead costs, 0.3%, but at least there's a downward trend. In 22 percent increase in the funding of wages, and the documentation turnover has gone down a little bit, and then there's common bidding, and the number of tenders, the amount of purchasing acquisitions from one supplier has decreased. In 2018, and the number of personnel have come down, but the average number of doctors has increased. So there's still there's a good sign that the management team is going down, and the doctors are growing. And there's the level of the age level is going down, so younger people, and the wages are growing. Nurses less decrease, but doctors a bit better increase. There's a project called the Moscow Doctor, and to a medical professional who receives this badge or this award of the Moscow Doctor receives a bonus. Thank you very much. I am totally satisfied with the answers, and I would like to conclude that I have no substantial conceptual critical remarks as to the dissertation, and therefore I would like to say that this dissertation makes a contribution to the field. The drawbacks and the questions don't belittle the quality of the work, diminish the quality of the work, and so the dissertation that is entitled the scientific rationale for the assessment methodology of state medical organization resources utilization and efficiency meets all the requirements of St. Petersburg University procedure of awarding academic degrees, and the candidate Oksana Aleksandrovna Volkova deserves the right to be awarded the sought academic degree of candidate of medical sciences in the degree field 14.02.03 public health and healthcare. The plagiarism clause of the regulations is not violated. So I endorse this dissertation. Thank you very much. Olga Vasilievna, thank you for your review. Marina Alexandrovna Shapovalova, please. Dear Igor Mikhailovich, dear members of the dissertation committee, the dissertation of Volkova, Oksana Aleksandrovna is very relevant, and there's a great need for up-to-date system of healthcare management, and within the resources available in the industry. Well, there's a lack of instruments to assess healthcare management. Of course, is the basis for this work. The conclusions are valid, and results are based on the tasks set by the candidate and by the methods that were a modification of the existing standard of quality management, efficiency management by the city government of Moscow. The approbation of the results has been carried out at different conferences. There's a large number of sources, literature, and the bibliography, including in foreign languages. I would like to say, because I need to ask a question and assess the work. There are some controversial things, despite the literature survey is quite profound. The studies surveyed focus more on the healthcare system management, and especially in the terms of economics, and less a comprehensive analysis of the work of healthcare organizations. As far as the terminology, medical organization, maybe you use synonyms like healthcare provision organizations. Well, in the chapter 3, there's a difference in the final sum of points of the assessment of the activities of state and state-supported organizations of healthcare, fully state-funded and self-supported, state-supported. What is the rationale for dividing medical organizations into subgroups? So, and therefore, for example, the autonomous, why is there not a basis for subdividing? Because the budgetary autonomous, that is partly supported, healthcare organizations function in different ways than fully state-funded organizations. And the second one is, what is the how did you estimate the weight of an indicator? Is there any classification where the values of the indicators of assessment and the corresponding weight, is there such a classification, or is this a original methodology or borrowed methodology? And also I'd like to ask about the interval between 2013 and 2018, and why do you provide results for 2013 and 2014? I would like to answer. The dissertation of Volkova, Oksana Aleksandrovna, complies with the requirements of St. Petersburg University, regulating the awarding of academic degrees of Candidate of Science and Doctor of Sciences, and therefore the candidate deserves to be awarded the third degree of Candidate of Medical Sciences. Thank you very much. Please, candidate. No, excuse me, Pavel Zlatarev, dear members of the Dissertation Council. I presented, I prepared a review which focuses on the relevance, the originality, the scientific significance, and the practical significance, and some statements about the structure. Let me not read out the review in full. I would like to focus on the relevance. This is a highly relevant, highly appreciated by the industry work. I'm following Oksana Aleksandrovna's publications, and because she has really devised a very clear set of instruments to assess efficiency management, the management efficiency in healthcare. This is a screening mechanism for all medical organizations, especially at the regional and even local levels. For example, healthcare, outpatient clinics, and local points of healthcare provision. Let me ask some questions. I have 3 questions, but one has already been asked, and I was satisfied with the answer. And this: to what extent is the developed methodology for assessing the effectiveness of resource management by medical organization universal and dynamic, taking into account the available indicators of the National Healthcare Project of the Russian Federation? Thank you very much. The developed methodology is quite versatile and dynamic, and really allows you to directly assess the achievement of individual target indicators of the National Health Project, in particular indicators of the federal project's provision of medical organizations of health care system with qualified personnel, in the development of the system of primary health care and preventive medical care, and indicators of optimization of the work of medical organizations providing primary health care, aimed at reducing the waiting time in queues when citizens apply simplifying the procedure for making an appointment with a doctor, and more. So in particular, the indicators of the effectiveness of personnel management of medical organizations proposed by the methodology reflect the organizational, economic, social areas of work with personnel, characterizing the professional level qualifications, age structure, the level of remuneration of various categories of personnel, turnover process, the ratio of the number of main medical and administrative personnel, etc. And an animal and in-depth study of the quality of personnel management in the network of medical organizations of state health systems of the city of Moscow, and the preparation of relevant information of the Department of Healthcare of the city of Moscow contributes to the adoption of balanced management decisions, for example, in order to reduce the administrative costs of medical organizations. Large inpatient and outpatient centers with a branch network were created in the capital. Conditions have been created to attract young specialists. The dynamics of salaries of medical personnel and the level of qualifications of personnel, etc., are analyzed annually. The next question, the second question, is it necessary to apply additional mechanisms to the developed methodology for assessing the effectiveness of resource management, taking into account the existing different profiles of medical organizations? No, taking into account the differentiated approach to the criteria for assessing indicators, interval levels of complexity for medical organizations depending on the type of conditions of medical care, as well as the type, budgetary, autonomous, state-owned, additional mechanisms for calculating indicators, and then assessing the effectiveness of medical organizations, providing a narrow profile. No medical attention is needed. Thus, an endocrinological dispensary, a neuropsychiatric dispensary, the Institute of Otorhinolaryngology, and other narrow profile medical organizations took part in the implementation of the project to introduce the method. And I'd like to give the floor to the next speaker. This is what I would like to conclude. The same speaker, sorry, still reading the review, the conclusion. The conclusion is that the candidate of the dissertation is entitled to the awardance of the Lindenbrot, please, Professor Lindenbrot, please. Dear Igor Mikhailovich, dear colleagues, members of the Special Committee, I would like to say up front that I think that this topic is very important, and because I work in public health, and we have our research are planned by state or research commissions, and we are carrying out research in management. And in order to talk about management, if we don't have information survey, and provision of information is key. So we have to have universal systems of tasks and indicators that the criteria and the indicators that allow management and healthcare departments to take any weighted decision. So This work in which these issues are tackled is very very relevant. This work is very significant. I can validate my opinion by the experience of looking at international experience and Russian experience. We already used these indicators, and these we are developing this system of management, decision making, structural approach, and the process focused approach, and result focused approach. So this resource, with the resource base available, so the originality is absolutely there. I have just questions, not criticisms really, that has to do with the practicing of implementation. There are some weights allotted to different indicators. Have a questions. Can it impact artificially on the excessive attention paid to some indicators at the expense of other indicators that do not have the comparable weight, smaller weight. So weighting factors do not affect the preference of the choice to improve a particular indicator. Considering that the total value of the weighting factors in each of the control areas is equal to 1, the task of the weighting factor is to reflect the importance of the indicator in a specific control area. Now, for example, in the field of personnel management, in our opinion, the most important indicator characterizing the share of administrative personnel in a medical organization with a weight coefficient of 0.3, and the next most important indicator of the proportion of doctors with a qualification category that is assigned a weight coefficient of 0.2, then with a weight coefficient of 0.15, the turnover rate and the share of core personnel. When correcting management goals and tasks set for a medical organization, we can arbitrarily revise the weight coefficients, which will entail a change in management influences. If in the process of development some achievements will be accumulated in some areas, then of course the weights can be changed, and they can be revised. For example, to decrease the impact of management role. That is, the proposed tool is not only a system for assessing the activities of a medical organization, but also a tool for managing its activities. To exclude the preference of the choice of indicators and improve the comparability of the score values indicators and the methodology developed for medical organizations, the boundary values of the assessment criteria are differentiated in accordance with the existing differences. Well, this is a very adaptive system. My second question has to do with the same thing. We've just heard about the difference between private and government funded organizations. Even within government-funded organizations, there can be different forms. In Moscow, for example, there's another new form for patronage service for less mobile patients. They call doctors to help them at home, and of course it incurs costs, etc. So with do you need to introduce certain changes in the methods if new forms of such changes of such healthcare provision emerges? With the appearance of fundamental new types and or organizational forms of medical care, while maintaining the normative legal regulation, including the activities of medical organization, changes in the methodology will not be required. They proposed in the methodology of a differentiated approach to the boundary values of the evaluation criteria for medical organizations of different types, as well as the types and conditions of medical care, makes it possible to use methodology including for assessing medical organizations. Well, in the COVID pandemic, home calls services are increasing, but they are provided as part of outpatient services. Well, it's all provided by the covered by the mandatory insurance of the persons who receive these services. So if there are no regulatory changes, that we don't need to change anything in our methods. Are you happy with? I am totally happy with the answers. This allows me to read the conclusion that the dissertation of Oksana Alexandrovna Volkova on the topic of rationale, scientific rationale, the assessment of methodology of state medical organizations associated to utilization efficiency, has both theoretical and practical significance. It's very important for the field of managing healthcare organizations, and in terms of methods, there's a mathematical apparatus used that brings added verification to the conclusions, and therefore the candidate Oksana Aleksandrovna Volkova deserves the right to be awarded a Candidate of Medical Sciences degree. I would like to give the floor now to for review and Professor Lukin, please. Dear Chairman, dear members of the Dissertation Committee, dear candidate, I would like to not to repeat what was said before me. First of all, I would like to stress the relevance of the topic. At the current stage, there's an assessment of the efficiency of medical organizations' activities. It's very, very hard to develop universal and clear and comprehensive methodology. Some use financial instruments, some other economics, and whereas in this one all these indicators are included. Non-financial indicators coupled with financial indicators reflect the real picture of human resources resources management. The second thing I want to stress is the large array of medical institutions that have been surveyed, questionnaires, a lot of people answered them, and all the results reflect the huge amount of work has been completed. Another thing that I would like to stress, another strength of the dissertation, is the validity of the results is based on empirical data. I have some critical remarks, but there are more suggestions for future research. First of all, for me, one in the theoretical part of the work, where you compare different methods of management techniques, why didn't you include the survey of Soviet management strategies? Well, there was a big experience in that. The dissertation, why the results of quality management, how do they impact the efficiency of providing healthcare? How are the results of the efficiency of resources management? How does it reflect the efficiency of providing healthcare? But again, this is more about future work. I have some questions, of course. First one, the first one is, you say in your dissertation, you use the statement, if the efficiency of activities is based on is reflected in the quality of management, but this is an obvious one, but you put these two on their head. The management quality leads to the efficiency of managing resources, and a sign of effective my answers, a sign of effective management in the process of movement of a medical organization towards the planned result is to ensure the minimization of resource costs and the achievement of certain characteristics that provide the required level. In our case, the approved evaluation criteria lies in the field of determining the quality of management. Thus, in the practice of organizations, efficiency and quality are inseparable and interdependent. Management cannot be highly effective if it is of low quality, and conversely, it cannot be of high quality if it is ineffective. Consequently, efficiency is one of the characteristics of management quality, and quality is an essential factor in efficiency. Thank you very much. Then my second question that follows from my first question. You say that at the basis of quality of the indicators of management quality lies the meeting of planned indicators. It is assumed that the effectiveness assessment proposed by the methodology is a continuous process that makes it possible to assess not only the achievement of planned values of indicators, but also the effectiveness of the management system of a medical organization, taking into account the time factor, past, current, and future events, results, growth increase in points and values of indicators, and the formation of positive or negative trends. The nature of changes in the dynamics of the values of indicators characterizing the efficiency of using the resources of a medical organization, material, financial, labor, etc. At the same time characterizes the quality of management, the main task of which it is to ensure an active impact on the controlled object in order to improve its performance. So as I already said, and it was formulated, so this was an active process. So this dynamic evaluation, you say that the consistency of planning with the account of quality of the predecessing years guarantees the quality of the management of quality in the future. Well, not necessarily guarantees the quality of management, but it can be a reference point for assessing the quality of the following activities, and therefore we can incorporate that into the planning of future activities. Yes, thank you very much. No. Yes, thank you. As my general conclusion, taking into account the presentation and answers to my questions, that allows me to say that the thesis that we are examining today fully complies with the requirements of St. Petersburg University on awarding academic degrees, and the candidate deserves the third degree to be awarded to her. Thank you. I would like to give the floor to Professor Meshkov, dear members of the Dissertation, dear Chairman. The more we go in our discussion, the fewer questions remain that are still new, and the fewer comments there are to make. As far as the relevance, again, I would like to reiterate, is obvious. It's in the assessment of the quality of management. The thesis provides a methodology that allows that can be applied not only to Moscow organizations, but other organizations in other regions, and to organizations of different type, different ownership forms, and all the questions that we heard that deal with the possibility of this work, the content of this work to spread across the industry, and the empirical study is huge, 220 organizations. The practical significance, of course, reflects that. Another factors that testifies to the practical significance of the work is that so many organizations, as we have heard, use this methodology already. It was very good for me to see that this dissertation, the author of the dissertation, is very skilled at formulating her ideas. I would like to say formally that the structure of the thesis is very logical. The goals and the relevance comply with the requirements of the field and the requirements of the regulations on awarding academic degrees at St. Petersburg University. And I would like to say that the overall, I would like to state that the candidate of sciences degree dissertation fully complies with the requirements, and the candidate deserves the third degree of candidate of medical sciences to be awarded to her. And the plagiarism clause of the regulations has not been violated. Now I would like to give the floor to Professor Zhikovsky for his review. I will not repeat my colleagues. I will just say that I had a great interest. I thought this paper, this work was very comprehensive. When I read this work, I still thought, well, we're studying Moscow healthcare, and while I was reading, I always had at the back of my head, is it possible to use this methodology to assess the medical organizations of other regions? And this question has been answered here already, and satisfactorily, and I think that we should we should expand the geography of your work under your guidance. For example, in Kazakhstan, the international experience studies is part of the work of our department. My second question has not been read yet, so therefore the work has repeatedly used such statistical terms as, for example, correlation. And yes, we just heard from the statistics, the word statistics, and also multivariate analysis. Do these terms really refer to statistical calculations made in the analysis of available data? But I didn't find really statistical conclusions or statistical calculations. Did you use them, these terms, as synonyms to the to the terms that you already said today, or is it something new? Well, statistical calculations performed in the course of data analysis included the determination of the relationship between the investigated performance indicators and performance criteria, taking into account the probabilistic nature of this dependence. The correlation method was used as a method for revealing the strength and direction of the connection. The concept of multivariate analysis is not related to statistical technique in a narrow sense, but to the analysis of a large number of factors, the studied indicators. So, management factors in this sense. So this was the multi-factor analysis. It was not this. I understood what I had questions about. Again, as a way of suggestion, if you have in the future an idea of looking at the increase of effectiveness in terms of indicators of the increase of satisfaction of patients with the work of medical organizations, or the decrease of disease rates and so on, then this statistics will be required, and I'm very happy with your answers, so no problem. So I'd like to read my conclusion. The dissertation of Volkova, Oksana, Aleksandrovna, in the degree field Public Health and Healthcare, Scientific Rationale and Assessment of Methodology of State Medical Organization Socio-Utilization Efficiency, fully complies with the requirements of St. Petersburg University procedure of awarding academic degrees, and the candidate deserves the third degree to be awarded to her. Thank you. Then I have some questions too, and you could read my review on the website, and I would like to stress that Moscow and Moscow region are quite complicated areas, regions to analyze, and St. Petersburg, well, she could achieve access to providing access to these organizations, so many organizations, and I doubt that we could have such an access in here in St. Petersburg and St. Leningrad region, and it's very hard to. So, for example, new operators, new providers of healthcare can use this methodology in order to assess their own activity and even plan their own activity. And also it's a very good tool for healthcare officials to make good decisions, and all the what we have we have computer-assisted calculations, and in terms of the management of these of the results, officials authorized to look at the data and the results of our surveys, and this is our program of professional development training, and you can see plans, state, regional state, in different years. It's broken into quarters, and then broken into indicators. Even the chief physician of a medical organization can understand that. Doctor, not economist or finance specialist, and but in terms of the management of the implementation of these results, a working group, a management group is created in each medical organization. They monitor and then implement, carry out the results. Medical doctors have to have some kind of background and understanding this. Yes, I would like to say that the dissertation by Oksana Aleksandrovna Volkova fully complies with the procedure of St. Petersburg University on regarding the awardance of academic degrees, and therefore the candidate is entitled to be awarded the third degree. I would like to say that is there any external comments by email or external reviews? No external reviews. Then we'll go back to the agenda. According to the regulation, according to the procedure, we can give the floor to members of the audience. No, there are no one willing to speak up. Then questions that have been submitted based on the presentation or the academic discussion. No questions. Therefore, we would like to give. Please, Oksana, and you can take a seat. I'd like to give the floor to your academic supervisor. Yes, Sergey Nikolaevich. Dear Sergey Nikolaevich, please tell us about the candidate and her work. Dear Chairman, dear members of the Dissertation Committee, I would like to briefly characterize Oksana Alexandrovna as a person. She is a very original person. Graduating from Luhansk Medical Institute, she went to the north of Russia to work there, and then landed a Moscow job. Later, she finally was invited to a research position in a research institute. newly formed research institute, and on the topic that we discussed today. I met with her not personally, but with her work, because I was a member of the dissertation committee at this institute. After a while, I saw this person in my office, because I had asked so many questions, and my colleague brought this person to me, and we started working together. And then she wrote a dissertation, and then another. We had the problem of dissertation committee not being able to function in my institution. And another difficulty was that it's an economic work. It's not a medical work. How can you defend your dissertation in medical sciences? Well, I advocated the idea that she's a practitioner, and this a very relevant work for medical science too. As a person, she is as a worker in the institute where she works. She's well respected, and she's a very nice person to talk to. Thank you very much for your very positive characteristic of our candidate. Do we have any other comments? No. Are there any questions by email? No. Therefore, the discussion and before we engage in discussion of the verdict. I need to ask if there are any objections or comments as to the procedure, including technical procedure. No objections, no criticism. Pavel Nikolaevich, no comments. No comments. Andrei Gennadievich, no comments. Dmitry Olegovich, no comments. Andrei Vyacheslamovich, no comments. Thank you very much. The voting. We can have a technical break, but I don't think we need one. So therefore, it is, have to say the time, 12:37. Does the curator agree? Yes. Dear colleagues, no, we haven't announced any breaks. We can no need. No? Do we need to switch off the microphone, deliberate? Do you need? Yeah, everything is clear. No need to switch off the microphone. Therefore, the separate deliberation of the results. Then we can proceed to the voting. Every member of the dissertation committee should voice their opinion publicly. We have membership list here, attendance list. Our this Volkova Aleksandra. I put to the vote the resolution of awarding Oksana Alexandra Volkova an academic degree of Candidate of Medical Sciences in the degree field 14.02.3, Public Health and Healthcare, on an open roll call voting. So, basis, I would like to remind you that a decision is positive if not fewer than 3 members of the Dissertation Committee votes. Dear member of the Dissertation Committee, Olga Vasilievna Mironenko, I will vote for the dissertation work of Volkova as fully complying with the requirements, and she deserves being awarded the Candidate of Science. Thank you very much, Olga Vasilievna. Marina Alexandrovna Shapalova, your opinion? Dear Igor Mikhailovich, dear members of the Dissertation Committee, I fully agree with the dissertation work, and Oksana Alexandrovna Volkova deserves the degree. Pavel Nikolaevich Zolotar, dear Migrasha, I vote for awarding the academic degree of Candidate of the Medical Sciences degree to Oksana Alexandra Volkova. Dear Alexander Leonidovich Underbratton, I support the work and I vote for the resolution to award the degree. Andrei Gennadievich Lukin, I think that the candidate is worthy of being awarded the degree. Thank you very much, Andrei Gennadievich. Dmitry Olegovich Meshkov, your opinion? Dmitry Olegovich, I think that the work meets the requirements of Candidate Sciences thesis, and the candidate deserves the degree. Andrei Mcheslavovich Grzhobskovsky, dear Igor Mikhailovich, dear colleagues, I support the work. The work complies with meets the requirements, and the candidate is worthy of a degree. As chairman of the committee, I vote for. 1 minute for the writing of the results. Dear Oksana Alexandrovna, out of 8 participants in the voting, members of the Dissertation Committee, 8 voted for the resolution to award the degree. Nobody voted against, and no one abstained. Therefore, the decision to award Oksana Alexandrovna Volkova an academic degree of Candidate of Medical Sciences is taken. Dear concluding word from the candidate, dear Chairman, dear members of the Dissertation Committee, I would like to thank you for meeting here. Thank you for the time. Thank you for accepting my dissertation for defense. Igor Mikhailovich, my personal thank you for allowing me to have a defense in your committee. Thank you very much, all the reviewers for. I express my gratitude to all the reviewers for their remarks and questions, and I would like to sincerely thank my academic supervisor for seeing me through and in this long road. If I had listeners, thank you, and remote. Yes, of course. Thank you very much, Olga Aleksandrovna, for your good words, and it's a very important stage in your life. And congratulations. On behalf of the committee, I'd like to thank you. St. Petersburg has greeted you with good weather. We are thankful to our leadership and the curators. Everything has gone smoothly. It's very hard to organize. Thank you for the organization, all the technical team. And personal thank you to the rector, Nikolai Kropichev, for making sure that such defenses take place, and for thank you all of you for coming here. Everybody's wearing masks, so we're all protected, and many vaccinated. Well, I would like to declare the session to be over, and so the broadcast should be switched off. Thank you, technical service, for the great work.